Just so that we can get a reading, darling. You gonna get a blood test done? You get 2. 1? That one?
T-shirts, 3 shirts and 2 blood needles.
You had 2 blood tests because they tried in one and it didn't work, and then so you had to get it done in the other one. And then you had 3 needles. Wow, you're so brave.
And then you can get it twice.
Wow.
I won 100
It's 100 years of Disney. Yeah, but look, there's a prize there because you're so brave.
Yeah.
And now what are we doing?
Waiting for Chris.
Waiting for
And then go to Starlight.
Yay.
And then we'll go back where we was.
Smile.
It doesn't taste like strawberry.
Can I see your face? Does it look pretty yet? Whoa. Wow. Cool. And this one. Wow. Oh, I did mine. Mom. You gotta count how many bunnies there are.
1, 2, 3.
That's the dentist there. That's the dentist. See? And that little bunny's getting her tooth cleaned. Where did you go now? You went to the dentist. What did you say? You got to clean your teeth 2 times a day. But he gave you a 7 out of 10. Happy birthday to you. What is that? Oh my gosh.
And I even got a one.
And then we're looking for 5 green ticks over on the right hand side. Yeah, so you see how there's one red cross, all those crosses? Yep, so that one's okay, so. So we are back home now, and Poppy is doing very well. In those clips, she actually had a cardiology appointment back home, and that was all clear. They actually discharged her from cardiology, so she won't be needing that service any further, which is really amazing. And then we went down to the hospital. She had the bone marrow transplant done again, just for reviews. We are 9 months post-transplant now, and so she had an appointment with her doctor, and he checked her cyclosporin levels, doing a blood test. Unfortunately, it had to be done in both arms because they couldn't, when they first accessed the vein, it didn't really produce any blood, so we had to try again. And then the levels are looking really good. I think the hemoglobin was 117, so she's still continuing to make red blood cells on her own, which is why we did this. And she had her vaccinations, so she had diphtheria, tetanus, and the flu shot as well. She's never actually had the flu shot before, but they encouraged us to it, and so she's had that now. So she had 3 needles. It's a big day for her. I think one of the clips showed her like lying down. She's very tired. And then we went to her respiratory appointment as well, and because she doesn't have the NG tube, when they put the mask on her, they got a more accurate reading, so it actually showed that it was very good. They weren't too concerned, and it gives us a general baseline, just following on from the bronchiectasis that she was diagnosed with after the bone marrow transplant, straight after, with that lingering cough, and she had to have the IV antibiotics for 3 weeks, and oral antibiotics before then as well. So we were struggling there for a bit, but that cough's gone away. They did a CT scan back in February, and that showed no bronchiectasis, but still some tiny black holes. So he didn't do another CT scan, but the respiratory test that they did was positive. He didn't have any concerns, the lung doctor. So we do go back in 3 months for the 12 months post-transplant appointments, and we will see her treating doctor as well. And she did see a dentist down at the hospital that we were at, and she does actually need braces. She's got an overbite, and it's going to cause her issues, so he said at about 11 she'll need to have braces, which was a bit surprising. And for someone who doesn't clean her teeth that often, she's actually a 7 out of 10 from the dentist's perspective when it comes to the teeth and cleanliness and the plaque and how she's looked after them, so that's real positive. She did see him before, prior to the bone marrow transplant, and I did ask him about the gums and how the cyclosporin was affecting that, and he said over time it does go away. It's not going to be immediate, but she's got quite gummy teeth because of the medicine. But the positive and takeaway from the appointments is that Poppy is actually going to be weaning off cyclosporin, so she no longer needs to have the dose that she was on, and we'll be weaning her actually off cyclosporin. So come 2 months, she will no longer be on any other medication. As soon as she gets off the cyclosporin, she'll be off the cyclovir, and she'll be off Bactrim as well. So that's just such a highlight, a real positive for Poppy, because we removed the nasal gastric tube probably 2 months ago now, and then She's been taking medicine orally, which is a benefit because she still needs to take medicine, or whether it's Panadol or anything else. So I think it's still beneficial that she did come off the nasogastric trip, but she takes medicine. It's sometimes a battle, but not always, and she usually just has the water. But the fact that she can actually administer it and take it herself is such a positive. So yeah, in the clips you saw, she got a birthday present from the people at the Starlight Foundation, the captains. So Poppy had just turned 5, and then we had a birthday party, and then we went down to the hospital. So it was a really positive experience because they remembered Poppy. Poppy went in there when we first went to the hospital to meet the doctors and see what the go was, and then they were there. That was one of the main places that she loved going. You know, it was like a bribe. Like once we do all appointments, then we can go up to the Starlight Room, you know, and have fun. They've got the games. They've got so many things for the kids to do, and it's a really amazing charity that's run. I don't know if it's worldwide, but I know it's here in Australia. Anyway, that's it for our 9-month update.